this is where we start thinking about more than just the vitamin D, the exposure to nature. And we're going to think about it, although you could think about it in other ways, we're going to think about it in light of the cortisol that we just talked about, that stress hormone. So all this work in forest medicine started back in the 70s when there was a study that was done that took a look at people who had had their gallbladders removed. And it was kind of interesting. You guys may have heard of this. There were two groups. So one group had a window that looked out onto a brick wall in their hospital room, and the other group had a window that looked out into nature. And what they saw was it was completely different in terms of the outcomes of the two groups. Like, you know, the people who were looking at the brick wall had more infections after surgery. They took longer to heal. It was pretty interesting. Now, in general, there are still some people who did some research here in North America, but in general, that was kind of ignored. And for whatever reason, Japan and places like Austria, Switzerland, and Germany really took up this and started to really do much more research on this. And even in Japan at this point, some of their medical universities have a department of forest bathing or forest medicine, just like they'd have a cardiovascular department, right? So what they'll do is they'll take patients and they'll do these saliva samples, and they'll take a look at hormones, and as we're going to see here in a second, natural killer cells, which are different types of immune cells. And they'll take one group, take them on a tour of the city where they go shopping, and nothing that's bad necessarily, but they'll take this other group and do the same amount of time in a natural setting. Now, it just so happens in the Japanese studies that they're going into evergreens. So I don't know if it's been worked out, if the same kind of changes physiologically happen in a deciduous forest, but theirs has been done, and in Austria as well, those have been done in evergreens. So anyway, what they see is that a 1 to 2 day sit, not one day for a couple of hours and then a second day for a couple of hours, has a significant cortisol drop that lasts up to 30 days. So although, I'm guessing you guys talk about sit areas and that kind of thing, we want our people doing sits as often as we can, right? From a health perspective, they may not have to do it every day, but they've got to do some of it, right? Now, this is the other one that was pretty fascinating is the natural killer cell numbers and activity increase. Now, natural killer cells are special types of immune cells that are active against viruses and cancers. And I mean, these activity increases, I don't have the numbers with me, but they were 40% kind of 40 to 50% increases. So, I think about that a lot of times, right? People will come in to see me and want to do vitamin C IVs for cancer. If I had, a substance that would do this, I would probably run that IV suite 24 hours a day, 7 days a week, right? And this is just at anyone's disposal, right? So I find that awesome.